Hello and welcome, everybody. As we continue now to reflect on the critical importance of sexual and reproductive health in shaping resilient and equitable health systems, it's clear that advancing global health requires sustained collaborative action across different sectors. And this brings us to our next section, which is a moment of celebration and renewed commitment. What do I mean with that? Well, Bayer's continued partnership with the World Health Organization exemplifies how industry can play a transformative role in supporting global health priorities. And we are honored to be here today to announce the continuation and extension of a powerful collaboration between Bayer and the World Health Organization. This renewed commitment reflects a shared vision to advance health for all by addressing some of the most pressing global health challenges, namely eliminating the burden of neglected tropical diseases, unlocking the potential of self-care, and addressing the health impacts of a changing climate. So as we gather here today, we're reminded of the critical role that multilateral organizations play in shaping global health outcomes. Equally, we recognize the transformative potential of the public-private partnerships, where industry brings not only the financial resources, but also the technical expertise, the innovation, and the deep commitment to equity and to impact. Bayer's continued commitment exemplifies this model, demonstrating how long-standing strategic collaboration can accelerate progress. Progress towards achieving the Sustainable Development Goals, as well as closing those healthcare gaps in underserved communities. And today's session will showcase concrete programmatic initiatives that are already making a difference, from medicine donations and digital tools to in-country consultations and research across more than 10 low-income countries. These efforts are not just about delivering services, they're about building those resilient systems, empowering communities, and creating scalable solutions that can be adapted globally. And on that note, I am so honored to welcome our distinguished speakers and leaders who have been instrumental in driving these things forward, namely Dr. Jeremy Farrar, Assistant Director General and Chief Scientist at the WHO. We have Dr. Claus Runge, SVP and Chief Health Equity Officer, Global Head of Public Affairs and Global Health at Bayer Pharmaceuticals. We have Ms. Daniella Foster, SVP Global Health of Public Affairs, Market Access, and Consumer Health at Bayer Consumer Health. And also we have Anil Soni, CEO of the World Health Organization Foundation. Welcome. Together, they will reflect on the impact of this partnership, share insights from the field, and issue a call to action to other companies and agencies to join in collaborative funding and co-implementation efforts. And this is more than just an announcement. It is also an invitation to rethink how we work together, how we mobilize resources, and how we can build a future where health is not just a privilege, but also a right. So let's begin with the first question. Dr. Farrar, I'm going to ask you how the renewed partnership with Bayer reflects the WHO's broader strategy to engage with industry in achieving that health for all, particularly in the context of the SDGs.
So thanks very much indeed, and apologies to be running in. It's good for my health and fitness, and so thanks for that. I'd really like to, you said it right at the start, we're living in extraordinarily difficult times. It's very difficult to not be nihilistic, very difficult not to pick up the news in the morning and think the world is awful. It's really important in moments like that that you pause, stand back and celebrate when good things happen, because the world will be better. But if you don't stop and say and celebrate, then you get caught in a vicious downward spiral of negativity. And we can't do that, because you can't be creative and think of the innovations of tomorrow and how to make the world a better place if you're nihilistic. So to celebrate this new partnership, when I say new, built on years, that's a very important point, because what's changed with this is that over time the trust has grown. and the willingness through the WHO Foundation, who deserve enormous credit, the willingness to now trust this relationship and therefore put it under a more encompassing integrated approach rather than a series of small projects is really critical. The more we can bring these things together, and a plea to other colleagues who may be here looking at the same model, bring it together rather than divided up salami slice, because that allows Bayer, it allows the foundation, and it allows WHO to do far, far more with the same amount. So thank you very much. Thank you very much to our colleagues at Bayer. Thank you very much to the Trust. We will both earn it and we'll demonstrate that this works.
So turning to you, Dr. Runge, from your perspective, what does Bayer's continued commitment to the World Health Organization signify in terms of the company's evolving role in global health, and how do you see this shaping future public-private collaborations?
First of all, I have to say it means a lot, period. It really means a lot because if you think about the people affected, in this case, affected by neglected tropical diseases, you're talking billions of people on this planet. Most of them, or many of them, living in underserved communities. So, and if a company spells out a mission, health for all, as we did, this is the perfect opportunity to live up to that mission. We've proven to be a reliable partner to the WHO, also many others in this ecosystem in the area of neglected tropical diseases for many years. We do have a long legacy of doing research and development in this field. The first products were used in the 1920s for different indications. And building on that over time, we have been able to provide the World Health Organization with some of the means, i.e. products, that it needed to push back some of the most pressing diseases. So we also subscribe to the Kigali Declaration as a company, and we continue to live up to that promise. So we have a whole list of legacy products that we will continue to provide the WHO with in kind. I just quickly made the maths before the meeting today. It's roughly 18 million units of medicine that the WHO can plan with going forward in the coming years, in the next 5 years. It's also supported by financial grants, but to me it really means there's a whole lot of patients that can be reached. And that's I would say, of most importance. Secondly, we recognize that the existing solutions may not be sufficient to fight some of the NTDs that are so burdensome, and that's why we continue to develop new medicines in this field. And I really want to call out the strong partnerships that we have with DNDi, with the Swiss Tropical Public Health Institute, that actually help us deliver new opportunities in river blindness, in STH, so in warm infections, and they show really promising results in phase 2 and 3. So we are very optimistic that at some stage in the future we may be able to amend the existing agreement with additional instruments in fighting NTDs. So it's a great day for us, as many employees are really geared by this mission to really make clear that we're in it, even if times are tough.
Ms. Foster, we're seeing this shift in how health systems are designed and delivered across the globe. How do you see the role of self-care and the impact of climate on health fitting into this new reality? And what's the role of industry in co-creating what comes next?
Well, thank you for that. And I want to pick up on what Jeremy said around bringing it all together. And I think, the opportunity right now and what we can start with is let's reframe health a bit. And what I mean by that is thinking of health not as just a destination that you go to occasionally, but as something that's embedded into our daily lives. And this is a bit where the self-care piece comes in. So we're living, of course, in a great time of global health stress. I think we all feel that. We are going through basically a global health stress test right now. Health systems are stretched thin, and we're seeing these cracks. These cracks are showing. So whether it's climate change, chronic disease, and access barriers, these are really compounding the strain that we're seeing on health. And for many, we know navigating health, period, is an absolute struggle. And I think about, 18 countries, nearly home to half the world's population. For them, the average primary care visit is just 5 minutes. Just 5 minutes. Think about that. So at the end of the day, that's not care. That's triage. And so globally, people may spend even beyond that only an hour max within a doctor's office. So the rest, what is the rest? It's self-care. It's self-care that we're talking about. And we're talking about science-based self-care that is part of the health continuum that is a key part of person-centered care. So when I think about this is really moving from reactive systems to proactive person-centered care, where self-care is not an afterthought, but a foundation. And we've long recognized this. We've had a long partnership, as you heard earlier, and we've supported these community-based approaches, local community, empowering individuals, strengthening local health systems. That's going to be critical in this next phase. And at the same time, we can be reflective and say, we still need to do more. And the answer isn't necessarily more of the same, but it's more of these models that meet people where they are. And specifically, one of the shifts around this point of intervention is going beyond just hospitals to homes, meeting people where they are, where they live, where they work, where they worship, and going beyond just specialists, but also to self-guided care within those points where self-care might be the only option, whether it's in a crisis situation or a pandemic. We saw that very clearly during those moments. So I fundamentally believe that one of the biggest transformations and transitions we can make is from sick care to well care, and that's where giving people the tools, the access, and the information to take care of their own health is essential. That's why I firmly believe in the power of self-care. We also see, from an economic perspective, it saves health systems over $119 billion annually, and there's much more we can do here. So to that point, that's why we're incredibly proud to partner with the WHO Foundation to embed self-care into national health systems and making it a core model of care and central to universal health coverage. So very specific to a core part of the agenda. And we've been doing this, of course, with individuals and caregivers for a long time. But this shift really now takes us from a partnership perspective into community health workers and specifically with policymakers, which is essential here. So this means that self-care pathways are at the fingertips of real people making real decisions for their families and communities, and backing it with, from our perspective, catalytic funding. One of the essential ingredients probably in all of the conversations everyone is having today is this question around financing and this piece around how we're bringing it together. So backing it with catalytic funding, which we're doing, and a coalition of partners to scale the impact. Because part of bringing it together means that we need to do it together. The other piece is climate. Climate is also a health crisis. It overlays with many of the conversations we're having. We especially see this for women, where climate change is reshaping health, and women are on the front lines being disproportionately affected, higher risks of pregnancy complications, food insecurity, gender-based violence after climate disasters. And 6 of the 10 countries most vulnerable to climate change also have the highest maternal mortality rates. So this is no coincidence. It's a warning. So this is also an area where, in partnership with the WHO Foundation, we see a gap between the research around women's health and sexual reproductive health and climate change. And this is where we're going to advance research on women's health and climate change because we see it being critical and we know we need that research. The other thing I would say is, what does climate resilience and health resilience look like? It really is about empowering people with the knowledge, with the tools, with access. It's investing in community-based care. It's pulling things through to the policy level and being able to help with those plans, and also helping families, community health workers, those to have the tools to self-care. So on this industry role piece and what comes next, this co-creation and bringing it together is important. I do think industry has a responsibility and an opportunity to lead. And we're not just talking about delivering products, that's one piece, but we're talking about co-creating solutions. We're talking about innovation. We're also talking about working with tech partners, NGOs, thinking through the policy pieces. So we are very proud to be a founding member of the UHC Accelerator, which is also an invitation for partners to bring it all together and join us in this, to help shape the future of health delivery and to co-invest in this, which is essential. And I think partnering on initiatives like One Health that helps cities protect people by tackling health risks like pollution, poor sanitation, and disease outbreaks is critical, because healthy cities need healthy ecosystems. We all have a role to play in that. So we support the work that the WHO has done on a self-care resolution and groups like the United for Self-Care Coalition, because this isn't just about innovation, it's about impact, and we all need to come along for that journey. So the future of health must be local, it must be digital, and it must be deeply human. And at the end of the day, we must build it together. So this is an invitation to do that. So we do hope you join us on this UHC Accelerator.
Thank you. Now, bringing in the perspective from the World Health Organization Foundation, Dr. Soni, how do you facilitate innovative funding models? What lessons have emerged from working with Bayer that could potentially be scaled to other partnerships?
Well, what's great about going forth is that all I really need to do is echo and repeat the points of my colleagues who I'm honored to sit next to. So I want to just start with coming back to Jeremy's point, which is that we live in a moment where the challenges are greater and the resources are lesser. And in such moments, it's even more true that any organization or sector cannot solve these challenges alone. So innovation is not a nice to have, partnership is not a nice to have, it's absolutely critical. And what the WHO Foundation was created to do was mobilize more resources and partnership to advance WHO's work, both by broadening the tent, getting more individuals, companies, and philanthropies, and companies from other industries to support WHO and see the alignment of what they care about with WHO's work, but also to deepen the partnership. And so I just want to say thank you and applaud what you've heard from Klaus and from Daniella, which is that Bayer is saying, we're going to keep going on our commitment to NTDs, right? 2 decades long, we're going to keep going. And we recognize that our company can add value across the full breadth of your enterprise relative to the broader breadth of what WHO does, including addressing the impact of climate on women and addressing the need for us to expand access to self-care, as Daniella described. When we talk about innovation, I think that there's incredible value in WHO nudging, prodding, cajoling industry in terms of the products and competencies that it brings to these problems. And likewise, and this is what makes for a good partnership, meaningful dialogue, companies able to engage WHO and colleagues like Jeremy and leaders like Jeremy and say, here's what we think WHO needs to be doing. And that's ultimately at the heart of it, because we have to rely on companies to drive innovation and to create more products. There's now a much broader range of companies that are creating products that are relevant for health. The number one source of health information now is the internet. And so we have to engage technology companies. That wasn't true 10 years ago. It's certainly true today. So engaging companies on the products they're creating is absolutely part of what we have to do as part of these partnerships. And also these companies asking for WHO's help in creating the regulatory and normative environment across all of its member states so that those products can have the impact that colleagues like Daniella and Klaus intend. I spent half of my career working in the private sector. I wasn't a bad person when I was there. I was a good person trying to create good products that had impact on the world. But those products' potential is in part adjudicated by the work of partners like WHO.
Thank you for that. Now, having heard about the learnings and looking ahead, just in one or two sentences, what would be one concrete action each of your organization will take in the next 12 months to advance this shared mission, health for all? Dr. Farrar, we'll start with you. Just one or two sentences. We don't have much time.
So we've been through a really painful reform process through this year, and I'm a little bit coming out of the depth of despair earlier than some others. But one of the changes that's been made under this umbrella that I'm now responsible for is the integration of all of the disease programs and all of the essential drivers of health and ill health, health promotion, disease prevention and care. And so that non-communicable diseases, neglected tropical diseases, malaria, mental health, you name it, it's there. But also the drivers, commercial and social drivers, nutrition, climate, urbanization, migration. For the first time, that is all in one happy family.
Fantastic.
And that gives us the opportunity to drive through change.
Dr. Soni, what would be yours?
I'm not a doctor. I feel compelled to correct that since I'm on stage with people who worked very hard to be doctors. So from my point, so one, I actually just want to build on Jeremy's because we advocate for WHO, and I cannot raise resources for an organization unless it is delivering impact and being fit for purpose. And there is so much that WHO is doing, some not of its own accord because of the disruption in aid, but some of its own accord. WHO over the last few years has said we need to set our sights longer. We need longer programs of work. We need to deliver outcomes. We can't just deliver inputs or activities. We need more flexible financing from our number one source of funding, which is governments. And there's now incredible integration across the House, including between the regulatory functions and the normative functions. And something that Jeremy and another colleague, Yukiko, who's not here with us, have achieved is they've said within 1 year, we're going to make sure that if we put a product in a normative guideline or on an essential medicines list, then we're making sure that we're pre-qualifying that product so it's available. We're not going to tell countries to use a product and then not make sure that it's available for you. So WHO has to deliver impact first and foremost, and that's what makes my job possible, because when WHO delivers impact, then I can work with colleagues like Daniella, to your question, and recruit more partners. That's my job. Bayer is an existing partner that is now doing more with WHO, and as Daniella said, in two concrete opportunities, both in self-care and in reproductive health and the impact on climate, they are joining pooled initiatives. They're not going out on their own. They're actually saying, we want to be here alongside other partners, and the foundation is the platform and the capacity to help recruit more partners to support that work.
What about then from a consumer health perspective, what would you add?
I go back to this piece around bringing it together. We're launching this Universal Health Coverage Accelerator here today. And the main thing I will be focused on is working with those of you who want to come partner with us in the spirit of advancing health for all.
Excellent. And from the pharmaceutical division?
I think these days we hear a lot about the private sector needing to step up. I think we're there. We're ready to step up even more than in the past. When it comes to NTDs, we will continue to follow the science. On the R&D side, we will make sure we get sufficient funding in-house and also externally to continue and finish the programs together with our partners DNDi, with TPH. And I think we can also play a role to complement the activities that the WHO has in-country provision of care. So, and that's where we also can learn of what good looks like in order to boost the effort of reaching more patients.
Mm-hmm. Mr. Soni, I'll hand over to you because I know you do have a final statement, and we'd like to give you the space for that.
I just want to pull to Daniella's point about pulling it together. We have to build on existing relationships as we invite other partners in. Bayer has worked with WHO for 2 decades to take diseases that were once thought permanent and intractable and make them diseases that can be eliminated. As Jeremy started with, we need hope these days. And that's a reminder of what's possible, of the potential that exists when the private sector and the public sector work together. So Klaus and Daniella, on behalf of Jeremy, myself, and all of our colleagues, thank you. Thank you for stepping up. Thank you for being an example of what other companies can and should do, for extending your existing commitment, because the job's not over, and countries need to know that you're stepping up alongside WHO. And thanks for broadening the commitment, because there's a lot more that we can and need to do together, and extending the commitment in such a way where you're inviting others along. Ego sometimes plays a big part in partnerships like these and in announcements like these, and sometimes companies say, here's what I'm doing, and it's my stamp. And in this instance, we have a company that's saying, we can't do it alone, we want others to come with us. And that spirit of collaboration, public and private sector, but also bringing other companies and philanthropies together, we need far more of that in the world today. And I hope those of you who are listening to us can feel a bit of that inspiration and know that there's a bit more that's possible, even in these dark days, when we work together. Thank you.
Thank you. Thank you. The word trust came up often today, and I can see a lot of trust up here in this panel. We really are so grateful for your insights and your perspectives. We do unfortunately have to conclude this engaging discussion on scaling impact through partnerships, but we've seen the powerful impact of collaboration between Bayer as an industry partner and the WHO as a multilateral organization, showcasing how this public-private partnership can drive that meaningful progress in global health. So again, I extend my heartfelt thanks to all of you. I also want to thank the audience for joining us for one or both of our panels, and also to the World Health Summit team for their excellent organization to allow us to come together today and engage around these two very impactful topics. So a big thanks to all of you as well. Thanks so much, and have a great evening.